Speaking in recognition of Nursing Week, Saint Lucia Nurses Association President Duncan reflected on the realities nurses encounter daily, including long hours, emotional strain, staffing shortages, and the increasing migration of healthcare professionals overseas. She addressed the importance of stronger policy support, improved working conditions, and greater public appreciation for nurses, while emphasizing the vital role they continue to play in patient care and national healthcare delivery. She called for the greater enabling of nurses to carry out their tasks wholly and effectively.
The nurses must be enabled to practice to their full scope. If we're talking about quality of care, we're talking about practicing to their full scope, delivering trusted, person-centered care in both primary and secondary care. So, there is a call for the public to reflect on the role of nurses and the impact that they have from birth to death. Recognize nurses with a kind gesture.
Duncan provided insight and reflection into what an empowered nurse looks like and the benefits of empowering local nurses.
Empowered nurses are essential to patient safety, quality of care, and population health. And the nurses in Saint Lucia, I want us to reflect that the nurses in Saint Lucia are doing an incredible work to save and improve lives even under enormous strain. Okay? Underinvestment in nursing carries enormous human and economic cost.
Celebrated under the theme Our Nurses, Our Future, empowered nurses save lives. Duncan says the focus is both timely and significant. While acknowledging the government's recruitment efforts to increase the number of nurses within the healthcare system, Duncan noted that gaps still exist between experienced senior nurses and newer entrants to the profession. She explained that these disparities can create challenges within the delivery and quality of healthcare services, particularly in a system where nurses remain the backbone of patient care. She also called for greater emphasis on the mental well-being of nurses.
We are at very high risk for what you call compassion fatigue. This means that we carry all of the cares or the stress of the patients that we care for. We carry these with us in and out of our homes, because we think of how are we going to address the concerns of the patients, both emotionally, physically, mentally, and that can take a significant toll on the life of a nurse. And so we are requesting for a monthly mental health day for every nurse.
Nursing Week runs from May 6th to 12th, ending on International Nurses Day on May 12th. The week is closely tied to Florence Nightingale, whose birthday falls on May 12th. Nightingale is widely regarded as the pioneer of modern nursing because of her work during the Crimean War and her influence on healthcare reform. Chelsea Austine, MBC Prime.